Good morning, everyone. My name is Ma Torres, and I'm here to share with you in this discussion about what make a good collaboration service team for public health. First of all, we know that to do a job in public health, we always need to work as a team. I did my voluntary hours in a clinic, in a public clinic here in Brownsville, Texas, and this clinic helped to the community to be healthy. They do screenings to all adults. It's for adults only, to all adults, and they also see patients, control the diabetes, hypertension, and also provide the immunizations to all the adults that they need. My job there was to help the people or the person in charge of the immunizations. I worked for 17 years as a immunization coordinator in a community was with low income, and I learned a lot in that place. But for now, I help them with the immunization also. But this time was for adults. I learned that this clinic they have a good communication within them, and this is the one of the important things to be uh, to be uh, to be successful in public health. The communication between the team. First of all, what I see is this the front desk. They have the person sketch an appointment for every patient, and she always need to call them in the morning to verify if they are coming or not. And then they send this information to the person in the back, the medical assistant, and the person who is in charge of the vaccines. And they prepare everything for every patient, and they check every single one what they need. Depends on the medical history. They work it in a very friendly way. I can say friendly, but it's like a responsible way. Is the exact word. Responsible. They are responsible. They know what they have to do. They have their own roles, their own responsibilities. This is the other point that we have to be always. We need to know what is our role in the professional where we are. We have to know what is our responsibility, what are not our what we have to do. That's the only thing that they need to know their roles and responsibilities. And I saw in that clinic, they know exactly what they have to do. When the patient came, they have like internal chat, and they communicate each other and telling this, like for example, the patient came with cough or with something that can be infectious and we can be contagious. They always said, oh, these people has cough, please use mask. And that's very important because this is communication, and we can protect each others. Or sometimes the front desk said and the internal shot, please be careful because this patient is rude or is with their mood is not good. Just be careful that try them in a gentle way, be kind with them because we need to be ethics. That's the only thing that always we have to do. They are not against us. It's against there's the way how they are, and then we need to act like professionals and not taking personal. That's the only thing that I learned there. Never take personal. See the person is angry or the person is in a bad mood. The other thing that I see is this: they always have to be to act in a personal way, and also they have to be responsible what they are doing. If they are in charge, for example, see they're in charge of putting all the information of the demographic. I'm coming from the beginning, and the front desk, yeah, responsible for the demographic or responsible for the appointment, for the phone number, or for the address of the people. They have to be make sure that everything is correct in the chart. Then go back and the with the medical assistants, they have to make sure they know all the medication that the patient is taking, all the things that the patient is missing. For example, see the person need a colonoscopy, or see the person need a pap smear, or need a diabetic for exam, for example. They need to check every single thing and the patient before the doctor see the patient. And one of the things that always need to be checked is the immunizations. When the person, when the medical assistant asks for the immunization, if the patient is not having it, they have to be put it on. Well, or of course, if they don't have a contraindication, but the doctor is the one who decides if the person receives it or not. And in the end, the doctor checked all the physical examination, all the medical exams, and in the end, I that's when I was did my voluntary work. With I helped with the person in charge, the nurse who was in charge of the vaccines. I helped to do all the documentations, the in-track, and check the immunization record that the patient has. All in public health, all is a teamwork. Always is a teamwork. And what I learned, what I know, what I learned in this course also, is always need to be in contact with and between each others, and always be in communications. I'm sorry. I will follow the rules. I will follow the responsibility, and you know your limits, your boundaries, and then it's gonna how the work team is gonna work. Thank you.